My name is Lori Barker. I'm a student at Central Carolina Community College. On November 5th, I interviewed Susan Van Fleet at her house in Hillsborough, North Carolina. Ms. Van Fleet has been a nurse for 35 years after earning her Bachelor of Science degree from Illinois Wesleyan University. For the last 24 years, she's been employed at the Pediatric Intensive Care Unit of North Carolina Children's Hospital. I spoke with Ms. Van Fleet to determine what shifts she has seen in her field over her time working there. According to her, the largest change in pediatric nursing has been the advent of family-centered care. More and more hospitals are moving to this model, in which the parents and other family members of minor patients are encouraged to take an active role in their hospital stay and treatments. Healthcare professionals and the patient's family work together to plan, provide, and evaluate treatment. Examples of hospital policies that a pediatric intensive care nurse can expect to encounter under the family-centered care model include 24-hour family visitation on the pediatric floor, active parent participation in treatment, greater collaboration between family members and healthcare professionals in determining appropriate courses of treatment, and an earlier transition from hospital to home health care. Much of the work of a pediatric intensive care nurse involves being a social worker, and this is true now more than ever. As the family-centered care model becomes more prevalent, the role of the parent becomes greater, and therefore so does the nurse's interaction with that parent. In fact, according to Ms. Van Fleet, it has become nearly impossible to separate the time spent on treatment from the time spent with parents. It isn't unusual for 30% of her patients to have a parent sleep by their bedside overnight, and many of the parents never leave. A solid knowledge of medicine is not enough to be a good pediatric intensive care nurse. They are now expected to spend a significant amount of time developing a relationship with the patient's family, consulting with them on treatment, explaining procedures, and providing comfort and support. Their success and job satisfaction depends on whether or not they enjoy this role and how well they are able to do it. Studies have shown that nurses that derive satisfaction from developing a relationship with the children and their families are more successful at dealing with the emotional stresses of dealing with sick children and death. In other words, as their job is not solely to cure or save a patient, but to provide comfort and support, nurses in family-centered care settings can still have a high level of job satisfaction even if a patient dies or a treatment is unsuccessful. This may reduce burnout, which is widely acknowledged to be a hazard of the nursing profession. The prevalence of family-centered care has increased dramatically over the past few decades and is expected to continue to increase. New nurses considering pediatric care as their specialty should do a thorough self-examination to determine if they have the empathy and social skills necessary to not only successfully develop relationships with patients' families, but to derive personal and job satisfaction from doing so.